All right, good evening, everybody. I'm going to kick us off today with the Fast 4 at 4. Lots of good news to share. First is a jobs announcement. The latest company to join Kentucky's manufacturing sector is Chapin International, a manufacturer of metal compressed air sprayers based in Bavaria, New York. Chapin plans to invest nearly $5.5 million and create up to 100 full-time jobs in the years ahead. The location will manufacture and distribute metal compressed air sprayers for industrial use, agriculture, home and garden, and other applications. This is a great project located in Rockcastle County, Kentucky. Representatives from Chapin reached out to our local and state economic development teams just over 2 weeks ago, and the company has already found a home in an existing former manufacturing facility in the Rockcastle Business Park. This is a testament to Team Kentucky's dedication to helping businesses find the best fit for them as quickly as possible. Kentucky's logistical advantages and ideal geographic location were major factors in our ability to bring Chapin to the Commonwealth. We are at the center of a 34-state distribution area in the eastern United States with the existing infrastructure necessary for companies to ship products to customers as quickly as possible. It's one of the many advantages Kentucky offers companies, and we're glad to have the opportunity to help Chapin International's business. Investments like this one from Chapin will help us to build a better Kentucky. All right, second up is voting. As many of you know, I'm a former civics teacher, and so one of my favorite things to do was to talk to my students about the democratic process and how important it is to be a responsible citizen and vote. As we all know, there is record turnout expected all across the country for the 2020 general election. And as a mom, it's very exciting for me because this is the first presidential election in which Emma, Will, and Nate will all get to participate. Evelyn is the only one that doesn't get to, and she's only 8 months old. So, our family has engaged in many discussions about democracy and how lucky we are to live in this country at a time when we have the right to vote. So, as a reminder, the deadline to register to vote is on Monday, October 5th. Visit govoteky.com for information on how to request your absentee ballot. Voting absentee is the safest way to vote this year because of COVID-19. So if you do not have access to the internet, you can call your county clerk's office to request your absentee ballot. The clerk's office will complete your absentee application over the phone with you. So that's an even easier step to be able to vote this year. Third, we have more good news about PPE. Kentuckians have continued to answer the call in the fight against COVID-19. It is this Team Kentucky spirit that makes our home so special. I can tell you that spirit of unity, despite a global pandemic, is on full display through the Commonwealth, from Paducah to Pikeville and Maysville to Monticello. 2 weeks ago, Governor Beshear and I visited the Department for Public Health's warehouse to show the success in securing PPE for frontline workers and other Kentuckians. As we all know, PPE is a vital part of protecting Kentuckians during this pandemic, and I am proud to report that as of this week, our Department of Public Health warehouse has completed the stockpile. There is enough PPE in Kentucky for a 120-day surge. Governor Beshear has talked about the time earlier in the pandemic when he spent days on the phone trying to secure PPE. He will tell you he was not sure that this day would come. This is one of the successes for Kentucky in our battle against COVID-19. Our team has worked diligently to secure the protective equipment we need in our hospitals, in our long-term care facilities, and other crucial frontline jobs. We appreciate those workers, our corporate partners, and everyday Kentuckians who contributed to make sure that we could reach this point. And last but not least, we're going to talk about Mask Up Kentucky and show some really good examples from across this Commonwealth of folks who are wearing their masks and doing the right thing. So first up, we have a group of kindergartners who are social distancing during their PE class. And so this is an example of how even our youngest learners are willing to do their part, and they're willing to be leaders in their schools. So we appreciate that. Next up, we have an example from Knox County School, where they have put a mask over their mascot that says "Can't Mask Our Pride." And we just really thought that this was a great example of that Team Kentucky spirit. So thank you, Knox County. Third, we have a picture of a workout from a University of Kentucky women's basketball team practicing for their upcoming season. They want to play, and they know that they have to be responsible enough to prepare in a safe and healthy way for their teammates, for their coaches, and for their supporters. And so, as a basketball coach, I thought we might need to give some love to the women's basketball players in Kentucky. And last but not least, not to be outdone, is a women's basketball practice at the University of Louisville. This is where the women's basketball team is trying to set a good example for all of us with their conditioning, and you can see that they're all masked. And I know that these women are far better athletes than I ever was, but it'd be really hard to work out and have a mask on at the same time. So I got to give them credit for going above and beyond to do the right thing, to keep themselves in shape, and to protect all of their teammates, coaches, and supporters. So thank you very much. Governor Beshear.
All right, thank you to our Lieutenant Governor. And today, continuing school pride here in the Commonwealth, I'm wearing Knox County Public Schools. This was sent to me by their Director of Communications with a really nice note talking about how their community had come together to fight for each other, to protect one another. And I love, this is the line they have under their letterhead: inspiring leaders and changing futures, one child at a time. So thank you to Knox County Public Schools. Also want to let you know we have a new member of our production team who is Jim, who's helping us out here moving forward. So now we have Kenneth at home. We miss you, Kenneth. We don't miss the slides, but we miss you. James, who is here working on that, and now Jim as well. Now, I've known Kenneth a long time. He'll take that in good humor, or we'll find out about it on Twitter here in just a little bit. All right. Well, that's good fun. Today's COVID report is not. Today, we are reporting our second highest total that we have had since March the 6th at 1,018. That's 1018 new positive cases of COVID-19. 157 of those are kids under 18 years old. What that means is that we are on pace to have even more cases than last week, where we set a record number of cases. It brings our total number of cases we've had in the Commonwealth to 67,856. Now, our test positivity is at 4.24%, still below 5%. That's a positive thing. We have 589 Kentuckians currently in the hospital due to COVID-19, 129 in the ICU, 81 currently on a ventilator. Please pray for those individuals. New cases by county: Jefferson 226, Fayette 143, Laurel County 58 cases, Warren 29, Barron 28, Christian 26, Madison 26, Hardin 22, Callaway 19, Boyd 18, Rowan 16, Kenton 15, Henderson and Scott 14, Boone and Franklin 13, Carter, Union, and Whitley 11, Davis 10, and all the others you can find on the website, as well as the breakdown of racial and ethnic data by both cases and deaths. Today, sadly, we are reporting a loss of 8 additional Kentuckians due to COVID-19, or that COVID-19 was a contributing factor to their deaths. They include a 68-year-old man from Hickman, a 71-year-old woman from Henderson, a 77-year-old man from Floyd, an 86-year-old man from Bullitt, an 86-year-old woman from Kenton, an 85-year-old woman from Floyd, an 87-year-old woman from Kenton, and a 93-year-old woman from Bell. Let's remember and think about those families. Let's make sure we turn on our green lights, and let's also know that when we have 1,018 cases, it means we're going to lose more people moving forward. 1,018 cases is far too many. It does mean we're doing a lot of tests, and that's important because we got to find those positives. We got to make sure that we can either quarantine them or get them the help they may need in the hospital. By finding those positive cases, it helps make sure that we can get them better. But 1,018 cases is going the wrong direction. So we need you to wear a facial covering. 1,018 cases ought to be a wake-up call if last week's 5,000, almost 5,000 cases wasn't. We can't let this thing get out of control again because maybe we're tired. We know the steps that it takes, and I think tomorrow we'll be back again with our revised top 10 rules to defeat COVID-19 because we probably need to talk about them more and again. But this mask, we really need you to wear it. We really need you to wear it. Long-term care facilities, since yesterday, 38 new residents, 23 new staff, 3 new deaths attributable to this population, 1 new facility. K through 12, again, this is our audited version. You're going to see the dashboard, which will have more up-to-date numbers, more immediate numbers. Again, remember, our dashboard is what's reported by schools for the day before. It hasn't gone through the vetting of the local health department and through us, but it's a way to have some immediate idea of what we may be seeing in your school or your community. And this is after it's gone through our process, which can lag 4 or 5 days. 15 new students, 14 new faculty or staff, 12 new schools with at least 1 positive case. This is just since yesterday on colleges and universities, 303 additional students, 2 additional faculty or staff, 3 new colleges or universities that are included. I know I said yesterday that I believed we were at the start of a new escalation. We're certainly seeing that in today's numbers. And that means we got to work harder. You know, this is a war, and we've won many battles. We can't walk away from the battlefield. We can't stop doing what it takes, and I really need your help. The fall, and I think Dr. Stack, who's back with us today after getting a week off, which I know was needed, will tell you that right now, moving into the fall, has the potential to be the most dangerous time we have seen in Kentucky. And it doesn't have to be, because we know that there is a vaccine in our future. We just have to get to the point where we can prove that it's effective and deploy it to enough people. So are we willing to do what it takes to protect one another until that point in time? I think that answer is yes, but we got to prove it. All right, I'm going to ask Dr. Stack to come up. He's got a couple of different things to go over, and then we'll answer questions.
Thank you, Governor. It's good to be back, and I know that the people watching this will appreciate it. It was nice to go somewhere where no one recognized me for a change, so I enjoyed my time away. I have a few updates I want to go over. James, could you show this? So I'm going to start with the schools. So for K through 12 schools, yesterday was the first day that the self-reported data from the schools went live as a public dashboard. So this was a screenshot that I took before I came here. You'll see a huge spike up in the data on the right-hand side. That's what you would expect. In the interest of clarity, the schools were asked to report yesterday, the 28th, data for the first 24 hours. So information reported them in the last 24 hours. I didn't want to, this was not a tag you're it moment. I'm not trying to go back in time. We're going to get a new steady state as we go forward. So people may have had folks in quarantine last week or new cases last week. That won't be captured here. It's a snapshot in time, and it's beginning on Monday the 28th. As I understand it, we have about 2,000 K through 12 schools in the state of Kentucky. That's public and private. Of those, we have about 1,700 plus in our database so far. Those who are not in the database, we're getting outreach and emails. Thank you. We appreciate that and we expect it. And we will add you if your name is not presented the way you want it presented. We'll update those things. So we're working through those details, but it just went live yesterday. We have over 1,300 schools who have reported data into this. So I'm satisfied that this is a good first step, but clearly when we're at a little over 1,300 reporting, and I just told you there's almost 2,000, we've got a ways to go. But for being only the second day that we've been doing this, thank you very much. I appreciate the effort. For those in the general public and for those who work in schools, K through 12, this is a tool for you more than for anyone else. So we have other surveillance tools that I'll use for public health, and I will definitely look at this, but this is for the public. For those of you who have children in K through 12 schools, you should be able to go here, you should be able to find your school by name, and you should be able to find the data that they've reported. If you don't find data here, I encourage you to call the school and ask them and inquire, and work in partnership with them. Remember, we get through this better if we work together. No one wins when we're pointing fingers at folks. This is all about trying to be honest and as open as we can, acknowledging the data as we understand it and being honest about that, and working together in good faith. So this is a tool for the public to try to help you be informed, at least in some closer to real-time situation as to what's going on in the school. We will report, the dashboard will update every morning with data from all the way through the previous day. And that's how that will be updated, and we'll go from here and see how that progresses over time. James, if I could have the next slide, please. Those of you who saw me discuss this a couple weeks ago will recognize this. This is the color-coded metric-based dashboard for schools to determine the mode of instruction they should be in for school. The way this works, you're supposed to look, if you're a superintendent or someone responsible for a school, every Thursday we recommend it at 8 o'clock at night because we update this around dinner time or late afternoon every day. You look Thursday evening at the map that we have on our website. I didn't put the map in here. It's published right on the main page of the website every single day. You match the color of your county to the color on this map. It's that simple. And then you do the things that are down the column. Now those are recommendations, and folks have asked, well, are these recommendations, are these requirements? So the reporting I just talked about, and a metric along this lines. Part of this comes from a KRS statute that talks about how schools behave during epidemics. This is all to give public health guidance so that superintendents can decide whether to have their students in person, virtual only, or hybrid instruction. And there are instructions and guidelines down there and a wealth of KDE documents. And the Kentucky Department for Public Health continues to work with the Kentucky Department for Education, so thank you for that partnership. We did make one change to this today, and this rests with me. I did not like that in some states they used a 14-day criteria that when they closed to in-person instruction, they had to shut down for 2 weeks. I wanted to use the metric as much as possible to guide decisions to open and close and not pick an arbitrary number of 14 days. So I put in there, instead of a 14-day metric, that when you hit the red level, which is a very high level of disease, that you had to get back down to yellow before you should consider resuming in-person instruction. I describe that as chutes and ladders. You hit the long chute, if you remember that game, and you went down a couple levels. I have removed that part, so now you just follow and you check on Thursday night, whatever color your county is what you should do for the following week. And you don't have to get back down to yellow. I had said from the beginning, it is not our intent to strand people in the wrong categorization. The tool is intended to identify when the disease is particularly active in your community, the entire community. That involves K through 12 schools, but it also involves nursing homes and businesses and restaurants and bars. The whole community has to come together. It's a community-based problem, and the community has to come together to do what needs to be done to improve the situation. So the one change we made today was you don't have to go all the way back down to yellow to consider resuming in-person instruction, but we do strongly urge you to read everything that's on there, follow the guidance that's posted. And I have to place this in context before I go to my next slide. We have to take this seriously, folks. It's about to get colder. People are going to go indoors more. The disease is still out there. Every place on the planet Earth where people have gotten lazy and lax about following the things we recommend has seen a surge in disease. Every place. Now, we've had some improvements in hospital care and some improvements in treatment, but we have not had any massive breakthroughs. So we are in a position where if we take our eye off the ball, we're going to get in trouble real quick, and I'll make that point on the next slide. James, you can put that up there. So you've seen me use these, those of you who watch these briefings on a regular basis over and over. This is from the 91-DOVIC, I guess is the COVID-19 backwards website. And what it shows is adjusted by population, the number of new cases per million people in your state on a 7-day rolling average. And so if you look, New York got smacked hard and badly at the beginning. In fact, to this day, it's one of the areas that was the hardest hit in the entire United States and probably in the world, other than maybe Wuhan in the very beginning. New York has still managed to keep their disease burden relatively low, but even New York is still running. That line down there, I think, is a 50. So it's still running active disease, but it's much more suppressed. If you look at Kentucky, we're at about 150 to now actually 160 new cases per million people per day. You have to take my word on this. This is really hot. That's running very hot. Remember, this is a disease that when it gets out of control, it starts to double rapidly. And so the little simple math here, you go from 1 to 2 to 4 to 8 to 16. Those numbers are still relatively small. Well, you go from 150 to 300 to 600 to 1,200. Those are big numbers. So as you start getting those bigger numbers, that's more people sick. And after people get sick, hospitalizations follow. And after hospitalizations, that's when you can have deaths. And so what I put in here is New York is the red line, who's relatively well controlled. By comparison, if you were to look at Germany on a different map, I can't put those that I found yet on the countries and the states. If you were to take Germany, New Zealand, South Korea, places that have lowered the disease and really kept it there, they would be hugging all the way down near that black line at the very bottom. They've controlled the disease so well that in that country, if you didn't follow the rules, you could walk out in public and you'd have a very low likelihood of getting sick. But the reason it's that safe is because they followed all the rules and they kept things closed down. And so the people in those countries are remarkably safe, but it's because they have very strong adherence to the things we're recommending be done. So it's the U.S. overall is the orange line. And if you look, we had a surge in the beginning and a plateau and a surge, and then it came back down, and now it's on the upswing. And I don't remember the latest data, but as recently as the last 48 hours, there were at least 26 states who were having a noteworthy positive increase in cases. And then if you look at Kentucky, we had a nice long plateau, almost 3 months, at about 50 new cases per million per day. Then we surged up, and we have now reached a plateau of 150 to 160 new cases per million per day. But here's the challenge. The good news is we're not exponentially growing. The bad news is if you were to draw a line against this, we have a gentle upward slope, which means that actually over the last 4 to 6 weeks, we're losing ground. It's getting worse as we go on. And it's getting worse at a time that schools are going back into session, colleges and universities are in session, bars and restaurants are open. Now remember, we said we try to take a multifactorial decision-making approach to this. We look at a lot of different things. We recognize the importance of the economy and people's wellness and being at work and in activities, but we can't afford to let this get out of control. Here's the thing, for those who like casino metaphors, the house always wins. So here's the thing, people may flaunt the rules and disregard the rules, and you know what, you may luck out and it may work out okay. But the virus is the house here. I don't know what county or what city or where, but if we ignore the rules, someone's going to get bitten, and they're going to get bitten bad. I don't have to guess on that. I can tell you that with absolute certainty. Everywhere that people got sloppy, the virus got out of control, and it took a lot more lives. So please, when I talk these wrap-up points I'm going to make here, please take this seriously. I hope you've seen over the last 6 to 7 months, we have gone through a period in the spring where there was so much we didn't know, and there was legitimate reason to be terrified at what could happen. And now we've gotten into this phase where we know that if we take certain simple steps, that we can control the spread of the disease. Now, people are really tired of this. They're fed up with hearing about this stuff and they want to get back to their lives. But I'm going to tell you, that's not happening until we get to sometime next year, and probably not until past the summertime, because even when we get the vaccines, and I'm glad that things have gotten revised at the federal level, because now it's aligning with what I was saying for weeks before, is that we're not going to have sufficient amount of quantity of vaccination materials to get everybody until we get to the summer or beyond next year. Hopefully we'll get something in late December or early January, but it'll be a small amount and it will be for the highest risk or highest targeted individuals, and then we'll move forward from there. And when we get to a better place where we have more information and it's appropriate, we'll update you on vaccination plans, which we're actively working on too. But until then, we've got to wear masks. We have to physically distance more than 6 feet. You have to wash your hands. You've got to do three other things. If you have a cough, a cold, a runny nose, a fever, chills, do not leave your house. Do not go to work. Do not go to school. This, of all years, is not the year to be casual and spread any kind of infection. Because you know what? If you got a cough and a fever, people aren't going to assume you got the common cold. They're going to be worried you have COVID-19. Don't do it. If you're sick, stay home. If you're sick enough to need medical care, contact your primary care provider and seek advice. The next thing is you have to get your flu shot. The United States apparently ordered 200 million doses of influenza vaccination this year, which is higher than the 170 million they did the year before, and even that was apparently a peak of sorts. You have to go out and get your flu shot. Let's make sure we use all those doses and force the government to order more of them, because if you get the flu shot, it's going to reduce the burden of flu. And if you wear your mask, you know what? Flu spreads the same way COVID does. You wear your mask, you get your flu shot, there's a good chance we could shut down influenza this year. Again, if you're sloppy and careless, it's going to be impossible to know who has the flu and who has COVID. And people who are uncertain in their status are going to be subjected to a lot more needless worry, angst, and probably inconvenience while they go through additional testing. The final thing, I said, get your flu shot. If you're sick, stay home. Oh, and get tested. If you have symptoms or if you've had a high-risk exposure, there are more places to go get testing across the state of Kentucky than there have ever been before. Please go get tested. Now there's over 230 sites, and I remember when that was low double digits and creeping up, and now we're over 230 sites, and I'm sure that's incomplete. I'm sure there are even more places you can go get testing. And maybe not tonight unless they're handy, but we can update the slides. We are still supporting free testing in Northern Kentucky, in Lexington, at 2 locations supported by University of Kentucky. This is the Northern Kentucky drive-through and a drive-up. There's 2 different approaches here. Either one gets you the same result. Schedule an appointment, you go to Northern Kentucky. Here's University of Louisville. There's 3 locations, and you can go to their website and sign up or call that number. They're open, even at U of L, it's I think 6 or 7 days a week. You get a lot of ability there. And then here is in Lexington, this is Norton Healthcare. And this is a busy site. This is still doing a lot of testing, but the state supports that. And then here is the University of Kentucky. There's 2 locations. I know they have plenty of extra capacity, all these sites. And this isn't going to be here forever. We've used federal CARES funding to support this so that the public has access to testing as much as we can. But at least for the next few months, we're going to sustain this as we have the resource to do it. So please take advantage of these things. This is within our ability to affect. You got to wear these masks. And I got to tell you, as much as people have complained about it, it's not fun. I don't think anyone's got to the point that it's fun. But there are people who express their style through their masks. They match to their clothes. People understand that this is important. And this is a really, really trivial thing to concede, wearing a mask. If it can help get businesses open, get people back to activities, let kids be in school, and suppress the disease. But please, don't be cavalier. There is a lot of disease around Kentucky right now. If you are in a high-risk community or population, they say 65, I use 60. If you're 60 or older, or you have chronic medical problems, you got to stay away from other people, wear your mask, and take extra precautions, because it is not a good time in most parts of the United States to be out in public if you have high risks for complications from COVID-19. And in a parting thought, 10 to 15% of people who are recovering from COVID are now being categorized as potential what they call long haulers, people who have chronic fatigue, brain fog, persistent shortness of breath, all sorts of sort of nondescript or difficult to fully quantify symptoms, but it is very clear that we are finding there are more and more people who are impacted by this for a longer period of time who did not necessarily have any kind of severe disease at the initial time they were ill. There's a lot we don't know yet. We're in a much better place than we were at the beginning. There's a lot we don't know. Please, Team Kentucky, we came together before, we've come together again. Let's continue to come together as a community and as a state to do the right thing by each other, which at the end of the day is also the right thing by ourselves too. So thank you very much, Governor.
All right, we got a packed house of journalists that are here today and just a couple of questions that have been submitted. Nick, you want to kick us off? I think the question is about fall break primarily, and my concern about families traveling. First, none of our schools have been in long enough, and I hope that they would consider using that fall break time, if they are able to do in-person classes, to do in-person classes. I'm incredibly worried about where families could travel. One of the reasons that we made the recommendation to push back to September 28th is people wouldn't stop going to the beach. And then after going to the beach, where we saw so much infection spread, especially through eastern Kentucky, it spread at businesses and churches. And if you added schools to that, then just the community spread could go from that one trip throughout that county and beyond. So it is even more alarming with Florida now opening everything fully, even though they still have a 10% positivity rate. At least according to some, and what we see in other places too. So I would ask our Kentucky families, if your kids are going back to in-person classes, be very, very careful about where you travel, and you better hope and ask other parents do the same, because remember, just one family going somewhere else, not following our rules, bringing COVID back into the school could result in a shutdown of that school for a period of time. This is the virus that it just takes one person making a bad decision, and everybody around can pay for it. So very worried, and for my kids, I don't think they need a fall break. I just don't this year. And I think that we should lessen the days off, because the days they're in are fewer too.
That the health department do surprise visits just like they are with businesses?
The question is about health departments doing surprise visits to schools like they do to businesses. I don't know that, first of all, we want health departments to go to schools. Now, obviously following the school security rules, because we had to set up those rules for, sadly, to prevent mass shooters and other safety hazards in schools. I don't think they need to be unannounced, because I don't believe you're going to be able to get the kids to do something that they're not doing on any other day. But I do believe that health departments should be working closely with schools and should go and look. And it's not to catch people, but you can provide comments on maybe doing things better, maybe some things that nobody thought about. I believe especially our principals, our teachers, those administrators inside a school want the very best for their kids and for their own safety. Tom?
Is the 15-minute test going to become available in Kentucky?
So the White House announced, I think it was yesterday, that it's going to be shipping a very large number of Abbott rapid tests, and there's another word that's in there, because there's been two types of rapid tests to the country. It'd be about 100 million more to the entire country. Kentucky will receive its portion based on our population. We're going to receive them all between now and December 31st. Obviously, that's a long period of time. We are working on our plan to deploy them in places that make sense. There are advantages based on speed. There are some disadvantages to them, and there is not an unlimited amount of these tests and how we use them. So we had a meeting today where we're going through it. Obviously, some of our most vulnerable areas have received some of them already. When we look at our long-term care facilities, and then we're going to be looking at others where either we can monitor for a virus in an area where we might see a lot of spread. We can maybe make some of the activities that we recently started doing a little bit safer by having those. It is a test that comes with limitations but can provide us some additional safety as long as we understand what it is. We certainly welcome it. Now we have to make effective use of it. Joe? The question is about colleges and universities. I wouldn't say a third of today's report are colleges and universities because that 300 trails a couple days. But it's a large number. We are seeing a significant number of cases at our colleges and universities. Part of that is that some of our universities have very aggressive testing programs so that they are going to discover the virus. That is a good thing. I continue to be worried about the levels that we see. I also continue to be worried that there's just some things that we can ask college students not to do that they are still going to do. I think we saw that with football this last weekend. But I hope that our students continue to know that their ability to continue to be in and at a university in the way they are is dependent on their actions and reactions. And we're going to continue to have conversations with our universities. This isn't a static situation, it's a very dynamic one, and one where we have to look not just at the impact on the university, but the community around. Joe?
Are you worried that public confidence in the grand jury process that the mayor Taylor case is around them? If so, what do you think it would take to restore?
The question is, am I worried that public confidence is unraveling, I think was the word, in the grand jury proceeding in the Breonna Taylor case? I believe that I heard that the recordings are going to be made public. I think I heard that from the Attorney General's office, what was it, last night? Is that accurate? And provided that happens, everybody's going to get to listen for themselves. We'll know exactly what was presented, and then we can have this conversation based on direct facts. I do think if that decision has been made, it is a good decision because I believe that the public has a right to see and to question and to get responses, and that's a part of being transparent in government and a chance for everybody to explain in that process what they did and why. And so I look forward to that being released. And again, you're seeing other evidence come out based on open records from the different agencies that engaged in parts of those investigations. And that evidence is something separate from, but might have been included in what was provided to the grand jury. Is it Conroy?
Yes.
All right.
So switch over to state line. They just announced yesterday, last night, that they were going to send some students back to school with targeted means kindergarten and fifth grade in mid-October, and then evaluate whether they come November. What is your reaction to that?
The question is Fayette County Public Schools and their decision to send some targeted populations back until somewhere in mid-October, I think, when they're going to look. I think it fits with the advice that public health has provided. To my knowledge, Fayette County is currently orange as of yesterday, which allows for targeted groups to come into school. So I think, and I talked to Superintendent Kalk the other day, I think he very much wants to follow the guidance. Obviously, the community is a little complicated with a large university there too, but I have confidence in him and being a Fayette County Public School graduate in our schools and our teachers and our administrators in trying to do the right thing. I do think it generally follows the guidance, at least the spirit of it.
September, of course, continues to show it's been a rough month for COVID-19. I guess that relates to this question from businesses and even the public is when could you come back out and have more recommendations and
Question is if and when, based on the data that we're seeing, I could have more recommendations on whether it's business or others. I think right now one statistic I'm looking at very closely is the positivity rate. We certainly don't want to see that higher than 6 where we have been in the past. We have more cases than I want right now. The positivity rate is still staying in that 4.25 range, which is a positive. But I'm here 4 days a week, so we'll continue to watch the numbers and where they go and talk about it as they move. We cannot continue to have the highest week after the highest week after the highest week going into the fall. So again, we need people to wear their mask, social distance, practice good hand hygiene. Everybody at your work should not be back all at the same time. Take these things really seriously, because it's not just the right thing to do to protect other people, but it's the right thing to do to protect your business or your restaurant or your kid's school. This is one where Team Kentucky is what we've got to have. Everybody working on the same team, getting it done together. I think this is connected to Joe's question, but is there any comment from my office on a grand juror on the Breonna Taylor case filing a lawsuit requesting the grand jury records to be publicly released? I think the evidence in the case should be released. I think it ought to be posted online so that everybody can see it and easily see it. If the recording of the grand jury is going to be released, I think that should be posted online too. I trust the people of Kentucky with the truth, and I believe that we should all provide as much information on what we do in our government jobs as possible and be ready and willing to answer the questions.
Progress report on the job Ernst & Young is doing in unemployment?
We can provide, we'll work on that tomorrow, an update on E&Y's work on unemployment. It's been absolutely necessary to prevent us from falling further behind. We are gaining ground, but there continue to be a significant number of claims that we are working through. I think we're doing as well as any other state, but that's really not satisfactory to those that still need help. Most of our oldest claims are those most complicated, but we got to get through them, because some who may be denied regular unemployment would qualify for pandemic unemployment. So the longer it takes for us to get through their regular claim, the longer it takes for them to get the pandemic unemployment. So we've got to have urgency. That was the word from yesterday, and we are going to have it. I'm supposed to get a direct update tomorrow from the Labor Cabinet, and I tell you what, we'll do an update tomorrow night here from the Labor Cabinet.
Governor, I asked you yesterday about the transportation cabinet and the
You did.
driver's license station. You said you were going to check on that. Have you found anything out?
Yeah, the Tom's question from yesterday on the transportation cabinet, I believe we have had 3 positive cases of COVID-19 in and around the transportation cabinet where we deal with Real ID. Now, there are lots of Real ID offices. I do believe that there has been communication to coworkers on it, but we can step it up. If somebody was worried about not having that information, then we're not communicating enough, and we need to. This is new for us too, and we ought to step up and set that example. We are going to be installing, where we think that they are necessary, plexiglass, especially with how you deal with the public. I believe that there was some thought that everything could be done 6 feet apart, but listen, it's a small expense for how much it could protect people. I appreciate you bringing that to our attention, and our goal is when we find a problem to solve it. All right, will the state offer any further extension on renewals of driver's license similar to what was announced in July? That order expires September 30th. If I get this wrong, Latasha's going to correct me. The answer is yes. Tomorrow I'll be signing an executive order that allows for people to renew their driver's license via drop box or by mail. You still have to renew it in one of those two fashions all the way up to February of 2021. I'm told that I got that right. Now, it doesn't automatically extend, so make sure that either by that drop box or by mail that you get that done. This would be great. You could have the same picture for a long time. I don't think that there will be any need, at least I see right now, with the release of the grand jury transcripts to activate the National Guard or the Kentucky State Police. I think that what we're going to see are people reviewing it and then asking questions. I mean, that opportunity to lead with information, and hopefully what we'll see, and I think that we will, is when you give people the information, they still may have tough questions. But at least there is a basis to ask those questions. Now, and I think we saw these past several days, again, nonviolent protests. People wanted to know what the rules are generally and to follow them, but to still make their voices heard with just a few individuals that sadly want to take something like that and turn it into something violent, like the individual who shot 2 police officers, or some who vandalized. And then what we also see is opportunistic crime, right? Crime not directly attached to the demonstrations, but instead, because they're going on, people trying to take advantage of it. We call that looting. I think it's burglary that would occur any time that there is something distracting that is out there. So I don't anticipate that. I trust people with the truth. And again, there might be questions and hard questions, but I think that's what we'll see.
You announce deaths here every day by day, and after that goes through an audit process, and often that can be a delayed process when you finally announce it. Why does the state, your administration, not have the actual dates of death available so that we can track the true trend of deaths throughout the state instead of after they've...
Steve, you want to take that one?
So the question from Joe is, when we release deaths, the governor announces every day the deaths that we report for the day, and why don't we publish actual dates of death? And I would say that this goes bigger than COVID. So when a death certificate is filed, we have generally reported when the death certificate's filed and approved and the death is recognized as a COVID death. And it's one of those challenges where every time we give data, and we are very transparent, we give more and more data every time, there's always additional questions. And so we have been doing it this way like many other states from the very beginning. And so we have consistently done this. As the death certificates are cleared, as they're verified, we report them as they come in. And then, quite honestly, I'll just tell you, this is a reality of death certificates everywhere. I've been a physician, an emergency physician. I've signed quite a few of these over my career. Some death certificates are signed rapidly in 24 hours. Others may be signed after 3 weeks. And there's all these delays which are non-value added. They don't add anything to our understanding of how the disease is affecting people. So what we do is when we clear the death certificate, when they come in, we report them as they are cleared and they're validated, and you get that consistently the whole time. So I respect that that's a reasonable question to ask, but it's not a data point that we intend to start tracking. and trying to go back and catalog all that, it doesn't really change our understanding. The fact is, when the governor says 12 people have died, we've reviewed all the records and we've attested that we believe that COVID was contributory to it. We've shared the implications of the disease, and all the other stuff just starts to become background noise along the way. So it just changes the time that the information gets out, and now that we're at a steady state, it doesn't really affect the outcome.
All right, so once again, today we had the second highest total of new positive cases of COVID-19 that we have had. That's after having the single highest week last week. We gotta do better, and we can, and we should. To everybody out there doing it right each and every day, thank you. Keep it up, don't get tired. To everybody out there that does it right most of the days, we need just a little bit more from you. This is just the battle that we're in. We need your help. So that time that you're feeling tired, just lift yourself up, knowing you're living for other people. You're doing the right thing. To me, when I think about that, I think about living out my faith of loving my neighbor as myself, knowing wearing this mask protects my neighbor. If you're one that's done it just some of the time, now we need you. You can do it for your economy, you can do it for your kids, you can do it for other people. And to those that have never done it, I mean, we've lost over 200,000 people in this country. 200,000 people dead. I'd like to think that we could all admit with that we are at war with this virus, and you will do your patriotic duty. We need you to do it. Team Kentucky is about all of us, everybody doing their part, knowing that we are all connected more now than ever in our lifetime. So let's get out there, let's wear our masks, let's stay 6 feet apart, let's cut down our contacts. Let's remember that right now we're living for our kids, we're living for our economic future, we're living for each other. Let's do it right. Thank y'all.